A home care nurse is visiting a client with renal failure who is on fluid restriction. The client tells the nurse, "I get thirsty very often. What might help?" Which of the following would the nurse include as a suggestion for this client? A. Avoid salty of excessively sweet fluids. B. Use regular gum and hard candy. C. Use an alcohol-based mouthwash to moisten your mouth. D. Eat crackers and bread. Answer. A. Avoid salty of excessively sweet fluids. Rationale. To minimize thirst in a client on fluid restriction, the nurse should suggest the avoidance of salty or excessively sweet fluids. Gum and hard candy may temporarily relieve thirst by drawing fluid into the oral cavity because the sugar content increases oral tonicity. 15 to 30 minutes later, however, oral membranes may be even drier than before. Dry food, such as crackers and bread, also may increase the client's feeling of thirst. Allowing the client to rinse the mouth frequently may decrease thirst, but this should be done with water, not alcohol-based mouthwashes, which would have a drying effect. A client loses consciousness after strenuous exercise and needs to be admitted to a healthcare facility. The client is diagnosed with dehydration. The nurse knows that the client needs restoration of which of the following? A. Electrolytes. B. Non-electrolytes. C. Colloid solution. D. Interstitial fluid. Answer. A. Electrolytes. Rationale. The nurse knows that the client's electrolytes need to be restored. Rehydration after exercise can only be achieved if the electrolytes lost in sweat, as well as the lost water, are replaced. The client does not need to have non-electrolytes, colloid solution, or interstitial fluid restored. Non-electrolytes are chemical compounds that remain bound together when dissolved in a solution. Interstitial fluid is the fluid in the tissue space between and around cells. Colloids are substances that do not dissolve into a true solution and do not pass through a semi-permeable membrane. Endurance athletes who exercise for long periods of time and consume only water may experience a sodium deficit in their extracellular fluid. What is this electrolyte imbalance known as? A. Hyponatremia. B. Hyperkalemia. C. Hyponatremia. D. Hypokalemia. Answer. A. Hyponatremia. Rationale. Hyponatremia refers to a sodium deficit in the extracellular fluid caused by a loss of sodium or a gain of water. Hypernatremia refers to a surplus of sodium in the ECF. Hypokalemia refers to a potassium deficit in the ECF. Hyperkalemia refers to a potassium surplus in the ECF. Which acid-base imbalance would the nurse suspect after assessing the following arterial blood gas values? pH 7.30, PaCO2 36 mm Hg, HCO3 14 MEq/L. A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. Answer. C. Metabolic acidosis. Rationale. A low pH indicated acidosis. This, coupled with a low bicarbonate, indicated metabolic acidosis. The pH and bicarbonate would be elevated with metabolic alkalosis. Decreased PaCO2 in conjunction with a low pH indicates respiratory acidosis. Increased PaCO2 in conjunction with an elevated pH indicated respiratory alkalosis. The nurse is caring for a client with heart failure who is receiving high doses of a diuretic. On assessment, the nurse notes that the client has flat neck veins, generalized muscle weakness, and diminished deep tendon reflexes. The nurse suspects hyponatremia. What additional signs would the nurse expect to note in a client with hyponatremia? A. Muscle twitches. B. Decreased urinary output. C. Hyperactive bowel sounds. D. Increased specific gravity of the urine. Answer. C. Hyperactive bowel sounds. Rationale. Hyponatremia is evidenced by a serum sodium level lower than 135 MEq/L. Hyperactive bowel sounds indicate hyponatremia. The remaining options are signs of hypernatremia. In hyponatremia, muscle weakness, increased urinary output, and decreased specific gravity of the urine would be noted. The nurse is assessing a client with a suspected diagnosis of hypocalcemia. Which cardiovascular manifestation would the nurse expect to note? A. Hypotension. B. Increased heart rate. C. Bounding peripheral pulses. D. Shortened QT interval on electrocardiography, ECG. Answer. A. Hypotension. Rationale. Cardiovascular manifestations that occur with hypocalcemia include decreased heart rate, diminished peripheral pulses, and hypotension. On the electrocardiogram, ECG, the nurse would note a prolonged street interval and a prolonged QT interval. The nurse is reading a healthcare provider's HCP progress notes in the client's record and reads that the HCP has documented insensible fluid loss of approximately 800 milliliters daily. The nurse interprets that this type of fluid loss can occur through which route? A. The skin. B. Urinary output. C. Wound drainage. D. The gastrointestinal tract. Answer. A. The skin. Rationale. Insensible losses may occur without the person's awareness. Insensible losses occur daily through the skin and the lungs. Sensible losses are those of which the person is aware, such as through urination, wound drainage, and gastrointestinal tract losses. The nurse caring for a client with heart failure is notified by the hospital laboratory that the client's serum magnesium level is 1.3 milligrams per deciliter. Which would be the most appropriate nursing action for this client? A. Monitor the client for dysrhythmias. B. Encourage increased intake of phosphate antacids. C. Discontinue any magnesium-contained medications. D. Encourage intake of foods such as ground beef, eggs, or chicken breast. Answer. A. Monitor the client for dysrhythmias. Rationale. The normal serum magnesium level is 1.6 to 2.6 milligrams per deciliter. Cardiac monitoring is indicated because this client is at risk for ventricular dysrhythmias. Phosphate use should be limited in the presence of hypomagnesemia because it worsens the condition. It is not necessary to discontinue magnesium products. Ground beef, eggs, and chicken breast are low in magnesium. A nurse is assisting in the care of a group of clients on the nursing unit. When considering effects of each medical diagnosis, the nurse determines that which client has the least risk for developing third spacing of fluid. A. Client with a major burn. B. Client with an ischemic stroke. C. Client with Leydig cirrhosis. D. Client with chronic kidney disease. Answer. B. Client with an ischemic stroke. Rationale. Fluid that shifts into the interstitial spaces and remains there is referred to as third space fluid. This fluid is physiologically useless because it does not circulate to provide nutrients for the cells. Common sites for third spacing include the pleural and peritoneal cavities and pericardial sac. Risk factors include older adults and those with liver or kidney disease, major trauma, burns, sepsis, major surgery, malignancy, gastrointestinal, GI, malabsorption, and malnutrition. The client who has suffered a stroke is not at risk for third spacing. A nurse is planning care for a client with hypokalemia. Which interventions should be included in the plan of care? Select all that apply. A. Ensure adequate fluid intake. B. Implement safety measures to prevent falls. C. Encourage low-fiber foods to prevent diarrhea. D. Instruct the client about foods that contain potassium. E. Encourage the client to obtain assistance to ambulate. Answer. A. Ensure adequate fluid intake. B. Implement safety measures to prevent falls. D. Instruct the client about foods that contain potassium. E. Encourage the client to obtain assistance to ambulate. Rationale. Clients with hypokalemia will need instruction on potassium-rich foods, and all clients should maintain adequate hydration. Safety is also a priority because hypokalemia may cause muscle weakness, resulting in falls and injury. Hypokalemia is associated with constipation, not diarrhea, owing to decreased peristalsis. Severe kidney damage, such as glomerulonephritis, often leads to acute respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. E. Chronic respiratory acidosis. Answer. C. Metabolic acidosis. Which of the following descriptions best fits the acid-base disorder respiratory acidosis? A consequence of hyperventilation, for example, in fever or mental illness. B. Consequence of prolonged vomiting. C. Consequence of reduced alveolar ventilation, for example, due to emphysema. D. Consequence of tissue hypoxia, for example, in ischemic conditions. E. Consequence of strenuous exercise. Answer. C. Consequence of reduced alveolar ventilation, for example, due to emphysema. When the pH of the extracellular fluid drops, the kidneys A. Excrete more hydrogen ions. B. Excrete more bicarbonate ions. C. Excrete fewer bicarbonate ions. D. Secrete more hydrogen ions and more bicarbonate ions. E. Secrete more hydrogen ions and fewer bicarbonate ions. Answer. E. Secretes more hydrogen ions and fewer bicarbonate ions. Rationale. Excess hydrogen ion is eliminated from the body largely by the kidneys. Which of the following descriptions best fits the acid-base disorder respiratory alkalosis? A consequence of hyperventilation, for example, in fever or mental illness. B. Consequence of prolonged vomiting. C. Consequence of reduced alveolar ventilation, for example, due to COPD. D. Consequence of tissue hypoxia, for example, in ischemic conditions. E. Consequence of strenuous exercise. Answer. A consequence of hyperventilation, for example, in fever or mental illness. Which of the following statements is false regarding fluid and electrolyte balance? Fluctuations in diet will affect babies less because they have so much water content. B. Older people tend to become more dehydrated. C. Kidney functions tend to decrease as one ages. D. Aging correlates with problems in various organ systems, which can enhance acid-base imbalance problems. E. A fetus obtains water and electrolytes from the maternal bloodstream. Answer. A. Fluctuations in diet will affect babies less because they have so much water content. Administration of a medication in the elderly can result in a much higher dosage than the clinician might intend because A. The metabolic rate in the elderly is so high. B. The kidneys of the elderly do not work well. C. The elderly have less water content in the body. D. Other medications they take might enhance the concentration of another drug. E. They cannot regulate pH well. Answer. C. The elderly have less water content in the body. All of the following are examples of compensatory mechanisms that would occur as a result of metabolic acidosis except A. Buffer systems accept H+. B. Kidneys secrete H+. C. Kidneys retain H+. D. Kidneys generate bicarbonate. E. Respiratory rate increases. Answer. C. Kidneys retain H+. Extreme losses of bicarbonate ions, such as in diarrhea, will cause A. Acute respiratory acidosis. B. Chronic respiratory acidosis. C. Respiratory alkalosis. D. Metabolic acidosis. E. Metabolic alkalosis. Answer. D. Metabolic acidosis. Rationale. Metabolic acidosis occurs when pH decreases due to increased numbers of fixed and metabolic acids, from bicarbonate loss, or from depletion of bicarbonate reserve when hydrogen ions are not adequately excreted by the kidneys. A drowning victim will likely experience a period of blank until resuscitation begins. The acute respiratory acidosis. B. Acute respiratory alkalosis. C. Chronic respiratory alkalosis. D. Metabolic acidosis. E. Metabolic alkalosis. Answer. Acute respiratory acidosis. The nurse is performing an assessment on a client admitted to the hospital with a diagnosis of dehydration. Which assessment findings should the nurse expect to note? A. Bradycardia. B. Elevated blood pressure. C. Changes in mental status. D. Bilateral crackles in the lung. Answer. C. Changes in mental status. Rationale. A client with dehydration is likely to be lethargic or complaining of a headache. The client would also exhibit weight loss, sunken eyes, poor skin turgor, flat neck and peripheral veins, tachycardia, and a low blood pressure. The client who is dehydrated would not have bilateral crackles in the lungs because these are signs of fluid overload and an unrelated finding of dehydration. A nurse is caring for a client whose magnesium level is 3.5 milligrams per deciliter. Which assessment findings should the nurse most likely expect to note in the client based on this magnesium level? A. Tetany. B. Twitches. C. Positive trousseau sign. D. Loss of deep tendon reflexes. D. Loss of deep tendon reflexes. Answer. D. Loss of deep tendon reflexes. Rationale. The normal magnesium level is 1.6 to 2.6 milligrams per deciliter. A client with a magnesium level of 3.5 milligrams per deciliter is experiencing hypermagnesemia. Assessment findings include neurological depression, drowsiness and lethargy, loss of deep tendon reflexes, respiratory insufficiency, bradycardia, and hypotension. Tetany, twitches, and a positive trousseau sign are seen in a client with hypomagnesemia. The nurse aspirates 40 milliliters of undigested formula from the client's nasogastric (ING) tube. Before administering an intermittent tube feeding, what should the nurse do with the 40 milliliters of gastric aspirate? A. Pour into the ING tube through a syringe with the plunger removed. B. Dilute with water and inject into the ING tube by putting pressure on the plunger. C. Discard properly and record as output on the client's intake and output record. D. Mix with the formula and pour into the ING tube through a syringe with the plunger removed. Answer. A. Pour into the ING tube through a syringe with the plunger removed. Rationale. After checking residual feeding contents, the gastric contents should be reinstalled to maintain the client's electrolyte balance. The gastric contents should be poured into the ING tube through a syringe without a plunger and not injected by pushing on the plunger. Gastric contents are not mixed with formula or diluted with water, and should not be discarded. The nurse is caring for a client with heart failure. On assessment, the nurse notes that the client is dyspneic, and crackles are audible on auscultation. What additional signs would the nurse expect to note in this client if excess fluid volume is present? A. Weight loss. B. Flat neck and hand veins. C. An increase in blood pressure. D. Decreased central venous pressure, CVP. Answer. C. An increase in blood pressure. Rationale. A fluid volume excess is also known as overhydration or fluid overload and occurs when fluid intake or fluid retention exceeds the fluid needs of the body. Assessment findings associated with fluid volume excess include cough, dyspnea, crackles, tachypnea, tachycardia, elevated blood pressure, bounding pulse, elevated CVP, weight gain, edema, neck and hand vein distension, altered level of consciousness, and decreased hematocrit. The remaining options identify signs noted in fluid volume deficit. A client who is at risk for fluid imbalance is to be admitted to the nursing unit. In planning care for this client, the nurse is aware that which conditions cause the release of antidiuretic hormone, ADH. Select all that apply. A. Dehydration. B. HTNC. Physiological stress. D. Decreased blood volume. E. Decreased plasma osmolarity. Answer. A. Dehydration. C. Physiological stress. D. Decreased blood volume. Rationale. Antidiuretic hormone, or vasopressin, is produced in the brain and stored in the posterior pituitary gland. Its release from the posterior pituitary gland is controlled by the hypothalamus in response to changes in blood osmolarity. Stimuli for ADH release are increased plasma osmolality, decreased blood volume, hypotension, pain, dehydration from nausea, vomiting, or diarrhea, and stress. Which client is least likely to be at risk for the development of third spacing? A. The client with cirrhosis. B. The client with liver failure. C. The client with diabetes mellitus. D. The client with chronic kidney disease. Answer. C. The client with diabetes mellitus. Rationale. Fluid that shifts into the interstitial spaces and remains there is referred to as third space fluid. Common sites for third spacing include the abdomen, pleural cavity, peritoneal cavity, and pericardial sac. Third space fluid is physiologically useless because it does not circulate to provide nutrients for the cells. Risk factors for third spacing include clients with liver or kidney disease, major trauma, burns, sepsis, wound healing or major surgery, malignancy, gastrointestinal malabsorption, malnutrition, and alcoholic or older adult clients. The nurse is caring for a client with a diagnosis of dehydration, and the client is receiving intravenous, IV fluids. Which assessment data would indicate to the nurse that the dehydration remains unresolved? A. An oral temperature of 98.8 FB. A urine-specific gravity of 1.043 C. A urine output that is pale yellow D. A blood pressure of 120/80ths of a millimeter of mercury. Answer. B. A urine-specific gravity of 1.043 Rationale. The client who is dehydrated will have a urine-specific gravity greater than 1.030. Normal values for urine-specific gravity are 1.010 to 1.030. A temperature of 98.8 degrees Fahrenheit is only 0.2 point above the normal temperature and would not be as specific an indicator of hydration status as with the urine-specific gravity. Pale yellow urine is a normal finding. A blood pressure of 120/80ths of a millimeter Hg is within normal range. A registered nurse, RN, has instructed an unlicensed assistive personnel, UAP, to administer soap solution enemas until clear to a client. The UAP reports that 3 enemas have been administered and that the client is still passing brown liquid stool. What should the RN instruct the UAP to do? A. Administer a fleet enema. B. Administer an oil retention enema. C. Wait 30 minutes and then administer another enema. D. Stop administering the enemas until the healthcare provider is notified. Answer. D. Stop administering the enemas until the healthcare provider is notified. Rationale. Up to 3 enemas may be given when there is a prescription for enemas until clear. If more than 3 are necessary, the nurse should call the HCP, or act according to agency policy. Excessive enemas could cause fluid and electrolyte depletion. Options 1 and 3 are incorrect for these reasons. An oil retention enema is an enema that is used to soften dry, hard stool and would have no use in this situation. During an assessment of a newly admitted client, the nurse notes that the client's heart rate is 110 beats per minute. His blood pressure shows orthostatic changes when he stands up, and his tongue has a sticky, paste-like coating. The client's spouse tells the nurse that he seems a little confused and unsteady on his feet. Based on these assessment findings, the nurse suspects that the client has which condition? A. Dehydration. B. Hypokalemia. C. Fluid overload. D. Hyponatremia. Answer. A dehydration. Rationale. When a client is dehydrated, the heart rate increases in an attempt to maintain blood pressure. Blood pressure reflects orthostatic changes caused by the reduced blood volume, and when the client stands, he may experience dizziness because of insufficient blood flow to the brain. Alterations in mental status also may occur. The oral mucous membranes, usually moist, are dry and may be covered with a thick, pasty coating. These findings are not manifestations of the conditions noted in the other options. A nurse is assisting in the care of a client with pheochromocytoma who has been experiencing clinical manifestations of hypermagnesemia. When evaluating the client, The nurse should determine that the client's status is returning to normal if which is no longer exhibited. A. Tetany, B. Tremors, C. Areflexia, D. Muscular excitability. Answer. C. Areflexia. Rationale. Signs of hypermagnesemia include neurological depression, drowsiness and lethargy, loss of deep tendon reflexes, areflexia, respiratory paralysis, and loss of consciousness. Tetany, muscular excitability, and tremors are seen with hypomagnesemia. The nurse is preparing to care for a client with a potassium deficit. The nurse reviews the client's record and determines that the client was at risk for developing the potassium deficit because of which situation. A. Sustained tissue damage. B. Requires nasogastric suction. C. Has a history of Addison's disease. D. Is taking a potassium-retaining diuretic. Answer. B. Requires nasogastric suction. Rationale. The normal serum potassium level is 3.5 mEq/L to 5.0 mEq/L. A potassium deficit is known as hypokalemia. Potassium-rich gastrointestinal fluids are lost through gastrointestinal suction, placing the client at risk for hypokalemia. The client with tissue damage or Addison's disease and the client taking a potassium-retaining diuretic are at risk for hyperkalemia. A nurse is caring for a client with a nasogastric tube, NGT, who has a prescription for NGT irrigation once every 8 hours. To maintain homeostasis, which solution should the nurse use to irrigate the NGT? A. Tap water. B. Sterile water. C. 0.9% sodium chloride. D. 0.45% sodium chloride. Answer. C. 0.9% sodium chloride. Rationale. Homeostasis is maintained by irrigating with an isotonic solution, such as 0.9% sodium chloride. Tap water, sterile water, and sodium chloride are hypotonic solutions. In clinical estimates, blank of total body water is in the ICF and blank in the ECF. A. 1/10, 9/10. B. 1/4, 3/4. C. 1/2, 1/2. D. 2/3, 1/3. E. 1/3, 2/3. Answer. D. 2/3, 1/3. Rationale. The typical value of water losses and gains each day is 2,500 milliliters. Which hormones is released by heart muscle in response to excessive chamber volume? A. ADH. B. Aldosterone. C. PTHD. Acetylcholine. E. Natriuretic peptides. Answer. E. Natriuretic peptides. Rationale. Natriuretic peptides is released by cardiac muscle cells in response to increased atrial distension. The release of natriuretic peptides from the heart will decrease of ADH release. ADH promotes water reabsorption at the kidneys and stimulates thirst. Which hormone plays a central role in determining the rate of sodium reabsorption and potassium secretion? A. ADH. B. Aldosterone. C. BNPD. ANPE. Epinephrine. Answer. B. Aldosterone. Rationale. ADH hormone most affects the osmolarity of blood, decreased ADH secretion and suppressed thirst. The amount of potassium excreted by the kidneys is regulated mainly by aldosterone. Increased blood volume will decrease thirst. Aldosterone increases urinary sodium retention and therefore increases sodium ion concentration in ECF. The anions in highest concentration in the extracellular fluid are A, sodium, chloride, and bicarbonate. B, sodium, potassium, and bicarbonate. C, sodium, potassium, and chloride. D, proteins, bicarbonate and chloride. E, sodium, potassium, and phosphate. Answer: D, proteins, bicarbonate, and chloride. The principal cation in intracellular fluid is A, sodium B, potassium C, calcium D, chloride. Answer: B, potassium. Rationale: the principal ions in intracellular fluid are magnesium, phosphate, and potassium. All of the following are components of ECF except A, cerebrospinal fluid B, peritoneal fluid C, lymph D, aqueous humor E, RBCs. Answer: E, RBCs. In an adult female, the body consists of about blank % water. A, 60B, 50C, 40D, 70E, 80. Answer: B, 50. Rationale: by weight, the average human adult male is approximately 60 to 63% water, and the average adult female is approximately 52 to 55% water. Homeostatic mechanisms that monitor and adjust the composition of body fluids respond to changes in the blank fluid. A, lymphatic B, intracellular C, plasma D, extracellular E, cerebrospinal. Answer: D, extracellular. Intracellular fluid, ICF, is found only within blood vessels. B, lymph. C, the cells of the body. D, the interstitial space. E, the cerebrospinal fluid. Answer: C, the cells of the body. The two organs that play an important role in maintaining acid-base balance are the A, liver and gallbladder. B, liver and kidneys. C, heart and lungs. D, lungs and kidneys. E, heart and liver. Answer: D, lungs and kidneys. What would happen to the blood PCO2 of a patient who has an airway obstruction? A, blood PCO2 would increase, resulting in respiratory acidosis. B, blood PCO2 would increase, resulting in respiratory alkalosis. C, blood PCO2 would decrease, resulting in respiratory acidosis. D, blood PCO2 would decrease, resulting in respiratory alkalosis. E, blood PCO2 would increase, resulting in metabolic acidosis. Answer: A, blood PCO2 would increase, resulting in respiratory acidosis. How would a decrease in the pH of body fluids affect the respiratory rate? A, respiratory rate would increase. B, respiratory rate would decrease. C, respiratory rate would not change. Answer: a respiratory rate would increase. A client's kidneys are retaining increased amounts of sodium. The nurse plans care, anticipating that the kidneys also are retaining greater amounts of which substances? A, calcium and chloride. B, chloride and bicarbonate. C, potassium and phosphates. D, aluminum and magnesium. Answer. B. Chloride and bicarbonate. Rationale. Sodium as a cation. With increased retention of sodium, the kidneys also increase reabsorption of chloride and bicarbonate, which are anions. Options 1 and 3 are incorrect because calcium and potassium are cations. The same is true for option 4. A group of nursing students is reviewing information about body fluid and locations. The students demonstrate understanding of the material when they identify which of the following as a function of intracellular fluid. A. Maintenance of cell size. B. Removal of waste. C. Maintenance of blood volume. D. Transportation of nutrients. Answer. A. Maintenance of cell size. When an older adult client receiving a blood transfusion presents with an elevated blood pressure, distended neck veins, and shortness of breath, the client is most likely experiencing a. Anaphylaxis. B. Allergic reaction. C. Fluid overload. D. Pulmonary embolism. Answer. C. Fluid overload. Because metabolism continually produces acids, maintenance of pH within these incredibly narrow limits depends on two processes, buffering and compensation. Which statement describes a function of buffering? A. The lungs, under the control of chemoreceptor areas in the brainstem respiratory center, are responsible for controlling the amount of carbon dioxide in the blood. B. The renal system excretes acids and bases from the body as needed. C. The kidneys influence the maintenance of the normal acid-base balance by changing the rate of excretion or retention of H+ and HCO3 ions. D. It helps to prevent large changes in pH by absorbing or releasing H+ ions. Answer. D. It helps to prevent large changes in pH by absorbing or releasing H+ ions. During a blood transfusion, a patient displays signs of immediate onset facial flushing, fever, chills, headache, low back pain, and shock. Which transfusion reaction should the nurse suspect? A. Hemolytic transfusion reaction. Incompatibility of blood product. B. Febrile reaction. Fever develops during infusion. C. Allergic reaction. Allergy to transfused blood. D. Bacterial reaction. Bacteria present in the blood. Answer. A. Hemolytic transfusion reaction. Incompatibility of blood product. A client is diagnosed with body fluid hypoosmolality. Treatment involves restricting his intake of free water. Which fluids would the nurse most likely restrict? Select all that apply. A. Tomato juice. B. Milk. C. Broth. D. Apple juice. E. Tea. Answer. D. Apple juice. E. Tea. Rationale. Management of water excess typically involves free water restriction. Limited fluids include water, coffee, tea, and simple fruit juices such as apple juice. More concentrated fluids such as milk, broth, or tomato juice may be given. What nursing interventions would be appropriate for a patient diagnosed with deficient fluid volume? Select all that apply. A. Monitoring edema. B. Intravenous therapy. C. Electrolyte management. D. Nutrition management. E. Fluid restriction. F. Hypervolemia management. Answer. B. Intravenous therapy. C. Electrolyte management. D. Nutrition management. Which of the following clients would be a candidate for total parenteral nutrition? A. A postoperative appendectomy client B. A client with colitis and bloody diarrhea C. A client with diabetic ketoacidosis D. A client receiving intravenous antibiotics. Answer. B. A client with colitis and bloody diarrhea. The nurse writes a nursing diagnosis of fluid volume, excess. For a client, what risk factor would the nurse assess in this client? A. Excessive use of laxatives B. Increased cardiac output C. Renal failure D. Diaphoresis. Answer. C. Renal failure. Rationale. Excess fluid volume may result from increased fluid intake or from decreased excretion, such as occurs with progressive renal disease. Excessive use of laxatives, diaphoresis, and increased cardiac output may lead to a fluid volume deficit. A nurse is providing care to a client with an ECF volume deficit. The nurse suspects that the deficit involves a decrease in vascular volume based on which finding. Select all that apply. A. Orthostatic hypotension B. Dry mucous membranes C. Decreased urine output D. Slow filling peripheral veins E. Poor skin turgor. Answer. A. Orthostatic hypotension C. Decreased urine output D. Slow filling peripheral veins. Rationale. The signs and symptoms of an ECF volume deficit reflect decreases in fluid volume in the vascular and interstitial spaces. The signs and symptoms of a decrease in vascular volume include orthostatic or postural changes in pulse rate and blood pressure, i.e., an increase in pulse rate and decrease in blood pressure when the person moves from a lying to a standing position, weak, rapid pulse, decreased urine output, and slow filling peripheral veins. The signs and symptoms of decreased interstitial volume include dry mucous membranes and poor skin turgor. The nurse is caring for a client with hyperkalemia related to decreased renal excretion secondary to potassium-conserving diuretic therapy. What is an appropriate expected outcome? A ECG will show no cardiac dysrhythmias within 48 hours after removing salt substitutes, coffee, tea, and other K+ rich foods from diet. B. ECG will show no cardiac dysrhythmias within 24 hours after beginning supplemental K+. C. Bowel motility will be restored within 24 hours after eliminating salt substitutes, coffee, tea, and other K+ rich foods from the diet. D. Bowel motility will be restored within 24 hours after beginning supplemental K+. Answer. A ECG will show no cardiac dysrhythmias within 48 hours after removing salt substitutes, coffee, tea, and other K+ rich foods from diet. Rationale. If the client is taking a potassium-conserving diuretic, he must be mindful of the amount of potassium he is ingesting because the potassium level is more likely to elevate above normal. Cardiac dysrhythmias may result if hyperkalemia occurs. Supplemental potassium should not be added to the client's intake. Potassium does not have a direct impact on bowel motility. When the nurse reviews the client's laboratory reports revealing sodium, 140 MEq/L, potassium, 4.1 MEq/L, calcium 7.9 mg per deciliter, and magnesium 1.9 mg per deciliter. The nurse should notify the physician of the client's a high magnesium B, low calcium C, high sodium D, low potassium. Answer. B. Low calcium. Rationale. Normal total serum calcium levels range between 8.9 and 10.1 mg per deciliter. The nursing instructor is discussing fluid and electrolyte balance with a group of students. One of the students asks the instructor how fluids move to maintain homeostasis. The instructor formulates her response based on her knowledge that fluid homeostasis can be maintained by which of the following? Select all that apply. A. Diffusion. B. Active transport. C. Filtration. D. Acid-base balance. E. Osmosis. Answer. A. Diffusion. B. Active transport. C. Filtration. E. Osmosis. Rationale. Osmosis, filtration, diffusion, and active transport maintain fluid homeostasis. Acid-base balance concerns chemical reactions in the body that influence metabolism. During an assessment of an older adult client, the nurse notes an increase in pulse and respiration rates, and notes that the client has warm skin. The nurse also notes a decrease in the client's blood pressure. Which medical diagnosis may be responsible? A. Circulatory overload. B. Hypovolemia. C. Hypervolemia. D. Edema. Answer. B. Hypovolemia. Rationale. The nurse should recognize that hypovolemia, also known as dehydration, may be responsible. Additional indicators of dehydration in older adults include mental status changes, increases in pulse and respiration rates, decrease in blood pressure, dark, concentrated urine with a high specific gravity, dry mucous membranes, warm skin, furrowed tongue, low urine output, hardened stools, and elevated hematocrit, hemoglobin, serum sodium, and blood urea nitrogen, BUN. Hypervolemia means a higher than normal volume of water in the intravascular fluid compartment and is another example of a fluid imbalance that would manifest itself with different signs and symptoms. Edema develops when excess fluid is distributed to the interstitial space. Which solution is a crystalloid solution that has the same osmotic pressure as that found within the cells of the body and is used to expand the intravascular volume? A. Isotonic. B. Colloid. C. Hypertonic. D. Hypotonic. Answer. A. Isotonic. A client's intake and output is being measured and recorded each shift. The client has had the following intake: 3 ounces apple juice, 4 ounces tea, 5 ounces pureed chicken, 2 ounces mashed potatoes, 4 ounces orange gelatin, 2 ounces vanilla ice cream. What amount would the nurse document as fluid on the intake sheet? Answer. 390 milliliters. Rationale. Intake measurements include all oral and parenteral fluids. Oral fluids include any liquids ingested or any foods that become liquid at room temperature. Gelatin and ice cream are examples of solid foods to include. Pureed foods is not considered fluid intake, nor is mashed potatoes. Based on the measurements, the client consumed 13 ounces of fluid. 1 ounce is equal to 30 milliliters, so 13 ounces of fluid is equal to 390 milliliters. Sodium is the most abundant cation in the extracellular fluid. Which is true regarding sodium? A. If sodium is low, it means that there is not enough water. B. Sodium is not regulated by natriuretic peptides. C. Normal serum sodium levels range from 145 to 155 MEq/L. D. Sodium is regulated by the renin-angiotensin-aldosterone system. Answer. D. Sodium is regulated by the renin-angiotensin-aldosterone system. An infant is brought to the emergency room with dehydration due to vomiting. After several failed attempts to start an IV, The nurse observes a scalp vein. When accessing the scalp vein, the nurse should use an 18-gauge needle B, winged infusion needle C, central venous access D, intermittent infusion device. Answer: B. Winged infusion needle. Rationale: winged infusion needles are short, beveled needles with plastic flaps or wings. They may be used for short-term therapy or when therapy is given to a child or infant. A nurse is flushing a patient's peripheral venous access device. The nurse finds that the access site is leaking fluid during flushing. What would be the nurse's priority intervention in this situation? A. Remove the IV from the site and start at another location. B. Immediately notify the primary care provider. C. Use a skin marker to outline the area with visible signs of infiltration to allow for assessment of changes. D. Aspirate the catheter and attempt to flush again. Answer: A. Remove the IV from the site and start at another location. Rationale: the nurse is observing the signs and symptoms of speed shock. The body's reaction to a substance that is injected into the circulatory system too rapidly. The nursing interventions report symptoms of speed shock to primary care provider. Answer: B. Is interventions for fluid overload. Answer: C. Is interventions for air embolus. And answer: D. Is interventions for phlebitis. To reduce brain swelling by pulling water out of brain cells, a substance can be injected intravenously to increase the osmotic pressure of interstitial fluid. Which of the following properties must this substance lack in order to be effective? A. Permeable to capillary endothelium. B. Non-toxic to neurons. C. Permeable to brain plasma membranes. D. Impermeable to brain plasma membranes. E. Soluble in water. Answer: C. Permeable to brain plasma membrane. Consuming a meal high in salt will drastically increase the osmolarity of the blood. B. Result in a temporary increase in blood volume. C. Decrease thirst. D. Cause hypotension. E. Activate the renin-angiotensin mechanism. Answer: B. Result in temporary increase in blood volume. When pure water is consumed, A. The ECF becomes hypertonic to the ICF. B. A fluid shift occurs and the volume of the ICF decreases. C. Osmolarities of the two fluid compartments fall. D. The volume of the ECF decreases. E. The volume of the ICF decreases. Answer: C. Osmolarities of the two fluid compartments fall. Rationale: when water is lost, but electrolytes are retained, osmosis moves water from the ICF to the ECF. Water molecules move across cells by osmosis. The two major subdivisions of the ECF are the A. ICF and plasma. B. Interstitial fluid and plasma. C. Lymph and plasma. D. Serous fluids and lymph. E. Interstitial fluid and CSF. Answer: B. Interstitial fluid and plasma. Rationale: exchange between the two main subdivisions of ECF occurs primarily at the capillaries. A person with poorly controlled diabetes mellitus will develop a respiratory acidosis. B. Acute respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. E. Chronic respiratory alkalosis. Answer. C. Metabolic acidosis. A person who consumes large amounts of sodium bicarbonate, baking soda, to settle an upset stomach risks a respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. E. Lactic acidosis. Answer. D. Metabolic alkalosis. Rationale. Metabolic alkalosis occurs when pH increases due to the removal of hydrogen ions when bicarbonate ion concentrations are elevated. Prolonged vomiting can result in metabolic alkalosis. A patient with emphysema will exhibit signs of A. Chronic respiratory acidosis. B. Chronic respiratory alkalosis. C. Acute respiratory acidosis. D. Chronic metabolic acidosis. E. Metabolic alkalosis. Answer. A chronic respiratory acidosis. Rationale. Hypoventilation leads to respiratory acidosis. In response to respiratory alkalosis, the kidneys retain more hydrogen ions. The respiratory system plays a key role in maintaining acid-base homeostasis by eliminating carbon dioxide. Amino acids in solution contain both a negative and positive charge and thus are termed A, anion B, cation C, acid D, base E, zwitterion. Answer. E. Zwitterion. A patient who has been both vomiting and having diarrhea is losing all of the following except blank from his body. A. Water. B. Sodium. C. Bicarbonate ion. D. Hydrogen ion. E. Protein. Answer. E. Protein. The primary role of the carbonic acid bicarbonate buffer system is to buffer stomach acid. B. Buffer carbonic acid formed by carbon dioxide. C. Limit pH changes caused by metabolic and fixed acids. D. Buffer the urine. E. Increase ventilation. Answer. C. Limit pH changes caused by metabolic and fixed acids. Rationale. The phosphate buffer system exists only in intracellular fluid. The hemoglobin buffer system exists in both intracellular fluid and extracellular fluid. A buffer system consists of a combination of a weak acid and its associated anion. A chemical that minimizes changes in the pH of a body fluid by releasing or binding hydrogen ion is called A. Electrolyte. B. Acid. C. Alkali. D. Compensation. E. Buffer. Answer. E. Buffer. Angiotensin II produces a coordinated elevation in the ECF volume by all of the following mechanisms except A. Stimulating thirst. B. Causing the release of ADH. C. Triggering the production and secretion of aldosterone. D. Stimulating the kidneys to conserve sodium. E. Increasing PNS activity. Answer. E. Increasing PNS activity. The release of atrial natriuretic peptides from the heart will cause the body to A. Conserve sodium ions. B. Decrease ECF. C. Excrete potassium ions. D. Conserve sodium ions and decrease ECF. E. Excrete sodium ions and decrease ECF. Answer. E. Excrete sodium ions and decrease ECF. The nurse is caring for a client who had a parathyroidectomy. Upon evaluation of the client's laboratory studies, the nurse would expect to see imbalances in which electrolytes related to the removal of the parathyroid gland. A. Calcium and phosphorus B, potassium and sodium C, chloride and magnesium D, potassium and chloride. Answer. A. Calcium and phosphorus rationale. The parathyroid gland secretes parathyroid hormone, which regulates the level of calcium and phosphorus. Removal of the parathyroid gland will cause calcium and phosphorus imbalances. Calcium reabsorption by the kidneys is promoted by the parathyroid hormone. Major control over the extracellular concentration of potassium within the human body is exerted by A. Albumin B, aldosterone C, testosterone D, progesterone. Answer. B. Aldosterone rationale. Secretion of potassium into the urine is increased by aldosterone. Potassium excretion is caused by an increase in aldosterone stimulation and when the pH of the ECF increases. A client is admitted to the facility after experiencing uncontrolled diarrhea for the past several days. The client is exhibiting signs of a fluid volume deficit. When reviewing the client's laboratory test results, which electrolyte imbalance would the nurse most likely find? A. Hypomagnesemia B, Hypokalemia C, hyperchloremia D, Hyponatremia. Answer. B. Hypokalemia rationale. Intestinal secretions contain bicarbonate. For this reason, diarrhea may result in metabolic acidosis due to depletion of base. Intestinal contents also are rich in sodium, chloride, water, and potassium, possibly contributing to an ECF volume deficit and hypokalemia. Sodium and chloride levels would be low, not elevated. Changes in magnesium levels typically would not be associated with diarrhea. A nurse identifies a nursing diagnosis of excess fluid volume related to heart failure as evidenced by edema and weight gain. The nurse reviews the client's laboratory test results. Which plasma osmolality value would support the nurse's nursing diagnosis? A. 310 mosm per kilogram B, 280 mosm per kilogram C, 260 mosm per kilogram D, 300 mosm per kilogram. Answer. C. 260 mosm per kilogram rationale. Normal osmolality is 280 to 300 mosm kilogram. Plasma osmolality decreases in water excess and elevates in water deficit. Therefore, a result of 260 mosm per kilogram would support the diagnosis of excess fluid volume. Which client is at a greater risk for fluid volume deficit related to the loss of total body fluid and extracellular fluid? A. An infant age 4 months B. A man age 86 years C. A woman age 45 years D. An adolescent age 17 years. Answer. A. An infant age 4 months rationale. An infant has considerably more total body fluid and extracellular fluid, ECF, than does an adult. Because ECF is more easily lost from the body than intracellular fluid, infants are more prone to fluid volume deficits. Infants have a far greater volume of total fluid as a percentage of body weight than older individuals. However, this high percentage of fluid does not give infants a greater reserve against fluid deficit. Instead, it creates a vulnerability to fluid deficit due to the high percentage of fluid required for homeostasis. In addition, kidney immaturity and increased body surface area in relation to body size place infants at greater risk than older children or adults for fluid and electrolyte imbalances. A nurse is preparing a presentation for a group of older adults at a local senior center about the importance of fluid intake. As part of the presentation, the nurse plans to discuss how the intake and output of fluids is typically balanced each day. When describing the normal daily output of fluids, which component would the nurse identify as accounting for the smallest amount of fluid output? A. Perspiration. B. Feces. C. Exhaled air. D. Urine. Answer. A. Perspiration. Rationale. Normal urine output for 24 hours is approximately 1,500 milliliters if intake is normal. Loss of fluid through the skin as perspiration accounts for an average daily loss of 100 to 200 milliliters of fluid. In addition to perspiration, insensible fluid loss through the skin amounts to about 300 to 400 milliliters per day. Loss of fluid through the gastrointestinal system in the form of feces is usually minimal, approximately 200 milliliters per day. Loss of water through respiration is approximately 300 milliliters per day. A nurse is assessing a client and suspects an ECF volume excess. Which finding would the nurse identify as being most significant? A. Bounding pulse. B. Weight gain of 0.75 kilograms in a day. C. Increased blood pressure. D. Slightly distended neck veins. Answer. B. Weight gain of 0.75 kilograms in a day. Rationale. Although increased blood pressure, bounding pulse, and distended neck veins are signs of ECF volume excess, rapid weight gain, more than 0.5 kilograms per day, is the most significant symptom indicating ECF volume excess. A weight gain of 1 kilogram reflects retention of 1 L of ECF. Additionally, because the veins are very distensible, large volumes of fluid can be retained without any increase in blood pressure or changes in pulse or neck veins. Potassium is essential for normal cardiac, neural, and muscle function and contractility of all muscles. Which is false about potassium? A. Insulin promotes the transfer of potassium from the extracellular fluid into skeletal muscle and liver cells. B. Aldosterone enhances renal excretion of potassium. C. A person loses approximately 30 MEq of potassium. D. Normal serum potassium ranges from 5.5 to 6.0 MEq, L. Answer. D. Normal serum potassium ranges from 5.5 to 6.0 MEq, L. Rationale. Normal serum potassium ranges from 3.5 to 5.0 MEq, L. The most dangerous problems with electrolyte balance are caused by an imbalance between gains and losses of potassium ions. Which of the following is not a renal response to acidosis? A. Secretion of H plus B, increased tubule buffer activity. C. Reabsorption of sodium hydrogen carbonate. D. Release of HCl into peritubular capillary fluid. E. Removal of CO2. Answer. D. Release of HCl into peritubular capillary fluid. A nurse is reviewing the dietary intake of a client prescribed A. The client tells the nurse that he had a banana, yogurt, and bran cereal for breakfast and a potassium-sparing Dyer Tiki sandwich with a glass of milk for lunch. The intake of which food would be a cause for concern? A. Yogurt. B. Banana. C. Milk. D. Turkey. Answer. B. Banana rationale. Bananas are high in potassium and would place the client receiving a potassium-sparing diuretic at risk for increased potassium levels. Milk and yogurt are good sources of calcium and phosphorus and would not be a concern. Turkey provides protein and would not be problematic. A nurse who has diagnosed a client as having fluid volume excess related to compromised regulatory mechanism, kidneys, may have been alerted by what symptom? A. Muscle twitching. B. Nausea and vomiting. C. Fingerprinting over sternum. D. Distended neck veins. Answer. D. Distended neck veins. Rationale. Fluid volume excess causes the heart and lungs to work harder, leading to the veins in the neck becoming distended. Muscle twitching and nausea and vomiting may signify electrolyte imbalances. The sternum is not an area assessed during fluid volume excess. A nurse is required to initiate IV therapy for a client. Which of the following should the nurse consider before starting the IV? A. Select a primary tubing of about 37 inches, 94 centimeters long. B. Avoid replacing IV solution every 24 hours. C. Use half-instilled IV solutions before infusing a new one. D. Ensure that the prescribed solution is clear and transparent. Answer. D. Ensure that the prescribed solution is clear and transparent. Rationale. Before preparing the solution, the nurse should inspect the container and determine that the solution is clear and transparent. The expiration date has not elapsed, no leaks are apparent, and a separate label is attached. The primary tubing should be approximately 110 inches, 2.8 meters, long, and the secondary tubing should be about 37 inches, 94 centimeters, long. To reduce the potential for infection, IV solutions are replaced every 24 hours even if the total volume has not been completely instilled. A nurse is measuring intake and output for a patient who has congestive heart failure. What does not need to be recorded? A. Frozen fluids. B. Fruit consumption. C. Parenteral fluids. D. Sips of water. Answer. B. Fruit consumption. Rationale. Any water consumption must be recorded in order to closely monitor a patient who has congestive heart failure. Many of these patients are on fluid restrictions. Sips of water, parenteral fluids, and frozen fluids count as fluid intake. The amount of water in fruits cannot be measured. A client with uncontrolled diabetes develops hypophosphatemia. Which finding would the nurse most likely assess? Select all that apply. A. Respiratory muscle weakness. B. Confusion. C. Ventricular dysrhythmia. D. Constipation. E. Abdominal distension. Answer. A. Respiratory muscle weakness. B. Confusion. C. Ventricular dysrhythmia. Rationale. With hypophosphatemia, findings include neuromuscular dysfunction, weakness, especially respiratory muscles, fatigue, myocardial depression, ventricular dysrhythmias, rhabdomyolysis, confusion, coma, decreased oxygen delivery to tissues, renal loss of bicarbonate, calcium, magnesium, and glucose, bone changes, osteomalacia, and endocrine changes, insulin resistance. Abdominal distension and constipation are more commonly associated with hypokalemia. A client admitted to the facility is diagnosed with metabolic alkalosis based on arterial blood gas values. When obtaining the client's history, which statement would the nurse interpret as a possible underlying cause? A. I was breathing so fast because I was so anxious and in so much pain. B. I've been taking antacids almost every 2 hours over the past several days. C. I've had a fever for the past 3 days that just doesn't seem to go away. D. I've had a GI virus for the past 3 days with severe diarrhea. Answer. B. I've been taking antacids almost every 2 hours over the past several days. Rationale. Metabolic alkalosis occurs when there is excessive loss of body acids or with unusual intake of alkaline substances. It can also occur in conjunction with an ECF deficit or potassium deficit, known as contraction alkalosis. Vomiting or vigorous nasogastric suction frequently causes metabolic alkalosis. Endocrine disorders and ingestion of large amounts of antacids are other causes. Hyperventilation, commonly caused by anxiety or pain, would lead to respiratory alkalosis. Fever, which increases carbon dioxide excretion, would also be associated with respiratory alkalosis. Severe diarrhea is associated with metabolic acidosis. A nurse is administering 500 milliliters of saline solution to a patient over 10 hours. The administration set delivers 60 GTTS per minute. Determine the infusion rate to administer via gravity infusion. Answer. 50 GTTS per minute. Rationale. When administering 500 milliliters of solution over 10 hours, and the set delivers 60 GTTS per milliliter, the nurse would use the following formula. GTT per minute equals 500 by 60, 600,500 x 60 equals 30,600 equals 50 GTTS per minute. A nurse is monitoring a patient who is diagnosed with hypokalemia. Which nursing intervention would be appropriate for this patient? A. Encourage foods and fluids with high sodium content. B. Administer oral K supplements as ordered. C. Caution the patient about eating foods high in potassium content. D. Discuss calcium-losing aspects of nicotine and alcohol use. Answer. B. Administer oral K supplements as ordered. Rationale. Nursing interventions for a patient with hypokalemia, low potassium, include encouraging foods high in potassium and administering oral K as ordered. Encouraging foods with high sodium content is appropriate for a patient with hyponatremia, low sodium. Cautioning the patient about foods high in potassium is appropriate for a patient with hyperkalemia, high potassium. And securing the calcium-losing aspects of nicotine and alcohol use is appropriate for a patient with hypocalcemia, low calcium. A nurse carefully assesses the acid-base balance of a patient who is unable to effectively control his carbonic acid supply. This is most likely a patient with damage to which of the following? A. Kidneys. B. Lungs. C. Adrenal glands. D. Blood vessels. Answer. B. Lungs. Rationale. The lungs are the primary controller of the body's carbonic acid supply and thus, if damaged, can affect acid-base balance. The kidneys are the primary controller of the body's bicarbonate supply. The adrenal glands secrete catecholamines and steroid hormones. The blood vessels act only as a transport system. With regard to mineral balance, the primary site of ion loss in the body is the kidneys. A nurse is monitoring a patient who is receiving an IV infusion of normal saline. The patient is apprehensive and present with a pounding headache, rapid pulse rate, chills, and dyspnea. What would be the nurse's priority intervention related to these symptoms? A. Discontinue the infusion immediately, monitor vital signs, and report findings to primary care provider immediately. B. Slow the rate of infusion, notify the primary care provider immediately and monitor vital signs. C. Pinch off the catheter or secure the system to prevent entry of air. Place the patient in the Trendelenburg position and call for assistance. D. Discontinue the infusion immediately, apply warm, moist compresses to the site, and restart the IV at another site. Answer. A. Discontinue the infusion immediately, monitor vital signs, and report findings to primary care provider immediately. Rationale. The nurse is observing the signs and symptoms of speed shock. The body's reaction to a substance that is injected into the circulatory system too rapidly. The nursing interventions for this condition are discontinue the infusion immediately. Report symptoms of speed shock to primary care provider immediately, and monitor vital signs once signs develop. Answer B is interventions for fluid overload. Answer C is interventions for air embolus, and answer D is interventions for phlebitis. A nurse is caring for a patient who has fluid imbalance related to the development of ascites. Which imbalances would the nurse monitor for in this patient? Select all that apply. A. Extracellular fluid volume deficit. B. Protein deficit. C. Metabolic alkalosis. D. Sodium deficit. E. Plasma to interstitial fluid shift. F. Metabolic acidosis. Answer. A. Extracellular fluid volume deficit. B. Protein deficit. D. Sodium deficit. E. Plasma to interstitial fluid shift. Rationale. Patients with fluid loss due to ascites, fluid accumulation in peritoneal cavity leading to abdominal swelling, are at risk for extracellular fluid volume deficit, protein deficit, sodium deficit, and plasma interstitial fluid shift. A patient has been encouraged to increase fluid intake. Which measure would be most effective for the nurse to implement? A. Explaining the mechanisms involved in transporting fluid to and from intracellular compartments. B. Keeping fluids readily available for the patient. C. Emphasizing the long-term outcome of increasing fluids when the patient returns home. D. Planning to offer most daily fluids in the evening. Answer. B. Keeping fluids readily available for the patient. Rationale. Having fluids readily available helps promote intake. Explanation of the fluid transportation mechanisms, A, is inappropriate and does not focus on the immediate problem of increasing fluid intake. Meeting short-term outcomes rather than long-term ones, C, provides further reinforcement, and additional fluids should be taken earlier in the day. A nurse is assessing infants in the NICU for fluid balance status. Which nursing action would the nurse depend on as the most reliable indicator of a patient's fluid balance status? A. Recording intake and output. B. Testing skin turgor. C. Reviewing the complete blood count, CBC. D. Measuring weight daily. Answer. D. Measuring weight daily. Rationale. Daily weight is the most reliable indicator of a person's fluid balance status. Intake and output are not always as accurate and may involve a subjective component. Measurement of skin turbot is subjective, and the complete blood count, CBC, does not necessarily reflect fluid balance. A nurse is preparing an IV solution for a patient who has hyponatremia. Which solutions are the best choices for this condition? Select all that apply. A. 5% dextrose in water, D5W, B. 0.9% sodium chloride, normal saline, C. Lactated ringer solution, D. 0.33% sodium chloride, 1/3 strength normal saline, E. 0.45% sodium chloride, 1/2 strength normal saline, F. 10% dextrose in water, D10W. Answer: A. 5% dextrose in water, D5W, D. 0.33% sodium chloride, 1/3 strength normal saline, E. 0.45% sodium chloride, 1/2 strength normal saline, Rationale. 5% dextrose in water, D5W. 0.33% sodium chloride, 1/3 strength normal saline, and 0.45% sodium chloride, 1/2 strength normal saline, are used to treat hypernatremia, high sodium. 0.9% sodium chloride, normal saline, is used to treat hypovolemia, low volume. Metabolic alkalosis, hyponatremia, low sodium, and hypocalcemia, low chloride. Lactated ringer solution is used in the treatment of hypovolemia, low volume, burns, and fluid lost from gastrointestinal sources. 10% dextrose in water, D10W, is used in peripheral parenteral nutrition, PPN. A nurse is performing a physical assessment of a patient who is experiencing fluid volume excess. Upon examination of the patient's legs, the nurse documents pitting edema, 6 mm pit. Pit remains several seconds after pressing with obvious skin swelling. What grade of edema has this nurse documented? A. 1+ pitting edema, B. 2+ pitting edema circa 3+ pitting edema, D. 4+ pitting edema. Answer: circa 3+ pitting edema. Rationale: 3+ pitting edema is represented by a deep pit, 6 mm, that remains seconds after pressing with skin swelling obvious by general inspection. 1+ is a slight indentation, 2 mm, with normal contours associated with interstitial fluid volume 30% above normal. 2+ is a 4 mm pit that lasts longer than 1+ with fairly normal contour. 4+ is a deep pit, 8 mm, that remains for a prolonged time after pressing with frank swelling. A client with a diagnosis of colon cancer has opted for a treatment plan that will include several rounds of chemotherapy. What vascular access device is most likely to meet this client's needs? A. An implanted central venous access device, CVAD, B. A peripheral venous catheter inserted to the cephalic vein, C. A peripheral venous catheter inserted to the antecubital fossa, D. A midline peripheral catheter. Answer: A. An implanted central venous access device, CVAD. Rationale: implanted CVADs are ideal for long-term uses such as chemotherapy. The short-term nature of peripheral IVs and the fact that they are sited in small diameter vessels makes them inappropriate for the administration of chemotherapy. A nurse is caring for an older patient with type 2 diabetes who is living in a long-term care facility. The nurse determines that the patient's fluid intake and output is approximately 1200 ml daily. What patient teaching would the nurse provide for this patient? Select all that apply. A. Try to drink at least 6 to 8 glasses of water each day. B. Try to limit your fluid intake to 1 quart of water daily. C. Limit sugar, salt, and alcohol in your diet. D. Report side effects of medications you are taking, especially diarrhea. E. Temporarily increase food containing caffeine for their diuretic effect. F. Weigh yourself daily and report any changes in your weight. Answer. A. Try to drink at least 6 to 8 glasses of water each day. C. Limit sugar, salt, and alcohol in your diet. D. Report side effects of medications you are taking, especially diarrhea. F. Weigh yourself daily and report any changes in your weight. Rationale. Generally, fluid intake and output average 2,600 milliliters per day. This patient is experiencing dehydration and should be encouraged to drink more water, maintain normal body weight, avoid consuming excess amounts of products high in salt, sugar, and caffeine. Limit alcohol intake, and monitor side effects of medications, especially diarrhea and water loss from diuretics. The nurse is caring for a male client who has a diagnosis of heart failure. Today's laboratory results show a serum potassium of 3.2 meq/L. For what complications should the nurse be aware? Related to the potassium level? A. Pulmonary embolus. B. Cardiac dysrhythmias. C. Tetany. D. Fluid volume excess. Answer. B. Cardiac dysrhythmias. Rationale. Typical signs of hypokalemia include muscle weakness and leg cramps, fatigue, paresthesias, and dysrhythmias. Pulmonary emboli and fluid volume excess are not related to a low potassium level. Tetany can be a result of low calcium or high phosphorus but is not related to potassium levels. The nurse is assessing a newly admitted client and finds that he has edema of his right ankle that is 2 millimeters and just perceptible. The nurse documents this at which grade? A. 4 plus B. 3 plus C. Plus D. 2 plus. Answer. C. Plus. Rationale. The edema in the client should be graded as plus, which means that the edema is just perceptible and of 2 millimeters dimension. A measurement of 2 plus or 3 plus indicates moderate edema of 4 to 6 millimeters. A measurement of 4 plus indicates severe edema of 8 millimeters or more. Which of the following statements most accurately describes the process of osmosis? A. Solutes pass through semi-permeable membranes to areas of lower concentration. B. Water shifts from high solute areas to areas of lower solute concentration. C. Water moves from an area of lower solute concentration to an area of higher solute concentration. D. Plasma proteins facilitate the reabsorption of fluids into the capillaries. Answer. C. Water moves from an area of lower solute concentration to an area of higher solute concentration. Rationale. Osmosis is the primary method of transporting body fluids, in which water moves from an area of lesser solute concentration and more water to an area of greater solute concentration and less water. Solutes do not move during osmosis, and plasma proteins facilitate colloid osmotic pressure, which is related to, but not synonymous with, the process of osmosis. A client's most recent blood work indicated a K+ level of 7.2 meq/L, a finding that constitutes hyperkalemia. For what signs and symptoms should the nurse vigilantly monitor? A. Muscle weakness. B. Increased intracranial pressure, ICP. C. Cardiac irregularities. D. Metabolic acidosis. Answer. C. Cardiac irregularities. Rationale. Hyperkalemia compromises the normal functioning of the sodium-potassium pump and action potentials. The most serious consequence of this alteration in homeostasis is the risk for potentially fatal cardiac dysrhythmias. A nurse monitoring a client's IV infusion auscultates the client's lung sounds and finds crackles in the bases of lungs that were previously clear. What would be the appropriate intervention in this situation? A. Notify the primary care provider immediately for possible fluid overload. B. Check all clamps on the tubing and check tubing for any kinking. C. No intervention is necessary as this is a normal finding with IV infusion. D. Notify the primary care provider immediately because these are signs of speed shock. Answer. A. Notify the primary care provider immediately for possible fluid overload. Rationale. If the client's lung sounds were previously clear, but now some crackles in the bases are auscultated, notify the primary care provider immediately. The client may be exhibiting signs of fluid overload. Be prepared to tell the healthcare provider what the past intake and output totals were, as well as the vital signs and pulse oximetry findings of the client. The nurse's morning assessment of a client who has a history of heart failure reveals the presence of 2+ pitting edema in the client's ankles and feet bilaterally. This assessment finding is suggestive of what? A. Fluid volume excess. B. Hyponatremia. C. Metabolic acidosis. D. Hypokalemia. Answer. A. Fluid volume excess. Rationale. Edema as a characteristic sign of fluid volume excess, hypervolemia. Metabolic acidosis and hyponatremia are not directly associated with the development of peripheral edema. When caring for a client who is on intravenous therapy, the nurse observes that the client has developed redness, warmth, and discomfort along the vein. Which of the following interventions should the nurse perform for this complication? A. Elevate the client's head. B. Apply antiseptic and a dressing. C. Position the client on the left side. D. Apply a warm compress. Answer. D. Apply a warm compress. Rationale. Prolonged use of the same vein can cause phlebitis. The nurse should apply a warm compress after restarting the IV. The nurse need not elevate the client's head, position the client on the left side, or apply antiseptic and a dressing. The client's head is elevated if the client exhibits symptoms of circulatory overload. The client is positioned on the left side if exhibiting signs of air embolism. The nurse applies antiseptic and a dressing to an IV site in the event of an infection. A dialysis unit nurse caring for a client with renal failure will expect the client to exhibit which fluid and electrolyte imbalances? A. Fluid volume deficit and alkalosis. B. Fluid volume excess and alkalosis. C. Fluid volume excess and acidosis. D. Fluid volume deficit and acidosis. Answer. C. Fluid volume excess and acidosis. Rationale. Fluid volume excess can be caused by malfunction of the kidneys, i.e., renal failure. The kidneys are also responsible for acid-base balance, and in the presence of renal failure, the kidneys cannot regulate hydrogen ions and bicarbonate ions, so the client develops metabolic acidosis. A client is diagnosed with metabolic acidosis. The nurse develops a plan of care for this client based on the understanding that the body compensates for this condition by which of the following? A. Increasing the excretion of HCO into the urine. B. Increasing the excretion of H-ion into the urine. C. Increasing ventilation through the lungs. D. Preventing excretion of acids into the urine. Answer. C. Increasing ventilation through the lungs. Rationale. The body compensates for the metabolic acidosis by increasing ventilation through the lungs, thus increasing the rate of carbonic acid excretion, resulting in a fall in PaCO2. To compensate for respiratory alkalosis, the kidneys increase the excretion of HCO to the urine. Kidneys compensate for respiratory acidosis by increasing the excretion of H-ion into the urine. The kidneys respond to metabolic alkalosis by retaining acid and excreting HCO. When providing care for a client who has a peripheral intravenous catheter in situ, the nurse should do what? A. Change the site every 3 to 4 days. B. Flush the catheter every 6 hours with hypertonic solution if the IV is not in constant use. C. Clean the insertion site daily using sterile technique. D. Insert the largest gauge possible to maximize flow and minimize the risk of occlusion. Answer. A. Change the site every 3 to 4 days. Rationale. Peripheral IV site should be rotated every 72 to 96 hours, depending on the institutional protocol. IV insertion sites are not cleansed daily. Flushes are not necessary every 6 hours. Hypertonic solution is not used for IV flushes. The smallest gauge that is practical should be inserted in order to minimize trauma. A client admitted with heart failure requires careful monitoring of his fluid status. What assessment parameter will provide the nurse with the best indication of the client's fluid status? A. Intake and output measurements. B. Daily bun and serum creatinine monitoring. C. Daily weights. D. Daily electrolyte monitoring. Answer. C. Daily weights. Rationale. Due to the possible numerous sources of inaccuracies in fluid intake and output measurement, the record of a client's daily weight may be the more accurate measurement of a client's fluid status. Laboratory tests are helpful in assessing kidney function and electrolyte values, but do not provide the precise information on fluid losses or gains as is provided by a daily weight at the same time, using the same scale. The nurse reviews the laboratory test results of a client and notes that the client's potassium level is elevated. Which of the following would the nurse expect to find when assessing the client's gastrointestinal system? A. Diarrhea. B. Abdominal distension. C. Paralytic ileus. D. Vomiting. Answer. A. Diarrhea. Rationale. The client with hyperkalemia would experience diarrhea. Abdominal distension, vomiting, and paralytic ileum would reflect hypokalemia. A client who is NPO prior to surgery is complaining of thirst. What is the physiologic process that drives the thirst factor? A. Increased blood volume and extracellular overhydration. B. Increased blood volume and intracellular dehydration. C. Decreased blood volume and intracellular dehydration. D. Decreased blood volume and extracellular overhydration. Answer. C. Decreased blood volume and intracellular dehydration. Rationale. Located within the hypothalamus, the thirst control center is stimulated by intracellular dehydration and decreased blood volume. Dehydration occurs when water losses outpace water gain, causing the osmotic concentration of blood plasma to increase. A woman aged 58 years is suffering from food poisoning after eating at a local restaurant. She has had nausea, vomiting, and diarrhea for the past 12 hours. Her blood pressure is 88/50 and she is diaphoretic. She requires what? A. Intravenous fluids to be administered on an outpatient basis. B. Replacement of fluids for those lost from vomiting and diarrhea. C. An access route to administer medications intravenously. D. An access route to replace fluids in combination with blood products. Answer. B. Replacement of fluids for those lost from vomiting and diarrhea. Rationale. The therapeutic goal may be maintenance, replacement, treatment, diagnosis, monitoring, palliation, or a combination. This client requires intravenous fluids for replacement of those lost from vomiting and diarrhea. Arterial blood gases reveal that a client's pH is 7.20. What physiologic process will contribute to a restoration of correct acid-base balance? A. Increased respiratory rate. B. Renal retention of H ions. C. Hypoventilation. D. Increased excretion of bicarbonate ions by the kidneys. Answer. A. Increased respiratory rate. Rationale. Hyperventilation results in increased CO exhalation and a consequent increase in pH, with the goal of attaining the ideal of 7.35 to 7.45. Retention of hydrogen ions, increased excretion of bicarbonate ions, and hypoventilation are all processes that contribute to a decreased pH and an exacerbation of acidosis. Which of the following commonly used intravenous solutions is hypotonic? A. 5% dextrose in 0.45% sodium chloride. B. 0.9% sodium chloride. C. Lactated ringers. D. 0.45% sodium chloride. Answer. D. 0.45% sodium chloride. Rationale. 0.45% sodium chloride is hypotonic, while normal saline and lactated ringers are isotonic. 5% dextrose in 0.45% sodium chloride is hypertonic. Upon assessment of a client's peripheral intravenous site, the nurse notices the area as red and warm. The client complains of pain when the nurse gently palpates the area. These signs and symptoms are indicative of what? A. Phlebitis. B. Rapid fluid administration. C. A systemic blood infection. D. An infiltration. Answer. A. Phlebitis. Rationale. Phlebitis is a local infection at the site of an intravenous catheter. Signs and symptoms include redness, pus, warmth, induration, and pain. A systemic infection includes manifestations such as chills, fever, tachycardia, and hypotension. An infiltration involves manifestations such as swelling, coolness, and pallor at the catheter insertion site. Rapid fluid administration can result in fluid overload, and manifestations may include an elevated blood pressure, edema in the tissues, and crackles in the lungs. A nurse is preparing an education plan for a client with heart failure who is experiencing edema. As part of the plan, the nurse wants to describe the underlying mechanism for why the edema develops. Which mechanism would the nurse most likely address? A. Increased hydrostatic pressure. B. Decreased colloid-oncotic pressure. C. Increased capillary permeability. D. Blockage of the lymph nodes. Answer. A. Increased hydrostatic pressure. Rationale. The edema that occurs with heart failure is caused by decreased cardiac output with a backup of blood resulting from increased hydrostatic pressure. Decreased colloid oncotic pressure is the mechanism responsible for edema of malnutrition, liver failure, and nephrosis. Lymph node blockage is the mechanism responsible for edema associated with a mastectomy or lymphoma. Increased capillary permeability is the mechanism responsible for edema associated with allergies. Septic shock and pulmonary edema. An intravenous hypertonic solution containing dextrose, proteins, vitamins, and minerals is known as a volume expander B. Total parenteral nutrition C. Blood transfusion therapy D. Cellular hydration. Answer B. Total parenteral nutrition. Rationale. Total parenteral nutrition is a hypertonic solution containing 20% to 50% dextrose, proteins, vitamins, and minerals that is administered into the venous system. The primary extracellular electrolytes are A. Phosphorus, calcium, and phosphate. B. Potassium, phosphate, and sulfate. C. Sodium, chloride, and bicarbonate. D. Magnesium, sulfate, and carbon. Answer C. Sodium, chloride, and bicarbonate. Rationale. The primary extracellular electrolytes are sodium, chloride, and bicarbonate. A client has the following arterial blood gas results: pH 7.33, PaCO 242 mHg, HCO 319 MEq, L-POW 2 to 95 mHg. Which imbalance would the nurse suspect? A. Metabolic alkalosis. B. Respiratory acidosis. C. Respiratory alkalosis. D. Metabolic acidosis. Answer D. Metabolic acidosis. Rationale. The results reveal metabolic acidosis, which is characterized by a pH lower than 7.35 and a plasma HCO3 concentration lower than 22 MEq/L. Respiratory acidosis is indicated by a low pH accompanied by an increased arterial concentration of carbon dioxide, which often is clinically defined as a PaCO2 of greater than 45 mm Hg. Respiratory alkalosis is present when a high pH is accompanied by a blood carbon dioxide concentration lower than 35 mm Hg. Metabolic alkalosis is characterized by a pH higher than 7.45 and a plasma HCO3 concentration above 26 MEq/L. The normal pH range for ECF is 7.35 to 7.45. What is the lab test commonly used in the assessment and treatment of acid-base balance? A. Chemistry. IB. Complete blood count. C. Urinalysis. D. Arterial blood gas. Answer D. Arterial blood gas. Rationale. ABGs are used to assess acid-base balance. The pH of plasma indicates balance or impending acidosis or alkalosis. The complete blood cell count measures the components of the blood, focusing on the red and white blood cells. The urinalysis assesses the components of the urine. A 70-year-old client is scheduled for a colonoscopy and is prescribed a bowel preparation solution. The nurse would be alert for which potential imbalance. Select all that apply. A. Hypophosphatemia. B. Hyperkalemia. C. Hypocalcemia. D. Hyperphosphatemia. E. Hypokalemia. F. Hyperkalemia. Answer C. Hypocalcemia. D. Hyperphosphatemia E. Hypokalemia Rationale. Older adults are at increased risk for electrolyte imbalances during and after bowel preparation for procedures such as a colonoscopy or barium enema. Research has shown that bowel preparation solutions in clients over age 65 years are associated with vascular volume deficit, hyperphosphatemia, hypokalemia, and hypocalcemia. Which is a common anion? A. Chloride. B. Calcium. C. Potassium. D. Magnesium. Answer. F. Chloride. Rationale. Chloride is a common anion, which is a negatively charged ion. Magnesium, potassium, and calcium or cations are positively charged ions. A 50-year-old client with hypertension is being treated with a diuretic. The client reports muscle weakness and falls easily. The nurse should assess which electrolyte? A. Sodium. B. Chloride. C. Potassium. D. Phosphorus. Answer. C. Potassium. A healthy client eats a regular, balanced diet and drinks 3,000 milliliters of liquids during a 24-hour period. In evaluating this client's urine output for the same 24-hour period, the nurse realizes that it should total approximately how many ml? Of 500 B, 3,750 C, 3,000 D, 1,000. Answer. C. 3,000 Rationale. Fluid intake and fluid output should be approximately the same in order to maintain fluid balance. Any other amount could lead to a fluid volume excess or deficit. A physician orders an infusion of 250 milliliters of NS in 100 minutes. The set is 20 GTT per milliliter. What is the flow rate? A. 50 GTT per minute. B. 20 GTT per minute. C. 40 GTT per minute. D. 30 GTT per minute. Answer. A. 50 GTT per minute. Rationale. The flow rate, GTT per minute, equals the volume, ml, times the drop factor, GTT per milliliter, divided by the time in minutes. What is the rate of administration for packed red blood cells? A. 1 unit over 2 to 3 hours, no longer than 4 hours. B. 200 milliliters per hour. C. IV push over 3 minutes. D. As fast as the patient can tolerate. Answer. A. 1 unit over 2 to 3 hours, no longer than 4 hours. Rationale. Packed red blood cells are administered 1 unit over 2 to 3 hours for no longer than 4 hours. Answer B describes platelets. Answer C represents cryoprecipitate, and answer D describes fresh frozen plasma. A decrease in arterial blood pressure will result in the release of A. Insulin. B. Renin. C. Protein. D. Thrombus. Answer. B. Renin. Rationale. Decreased arterial blood pressure, decreased renal blood flow, increased sympathetic nerve activity, and/or low salt diet can stimulate renin release. A nurse is assessing a client's fluid balance status. The nurse understands that which organ plays the major role in regulating fluid balance? A. Skin. B. Lungs. C. Intestines. D. Kidneys. Answer. D. Kidneys. Rationale. Although the skin, gastrointestinal tract, and lungs play a role in fluid balance, the kidneys are the major organs regulating fluid balance. conserving or excreting water and electrolytes as necessary to maintain homeostasis. Potassium is needed for neural, muscle, and cardiac function. B. Optic function. C. Skeletal function. D. Auditory function. Answer. A cardiac function rationale. Potassium is essential for normal cardiac, neural, and muscle function and contractility of all muscles. Which client has more extracellular fluid? A. Adolescent man. B. Newborn. C. Female school-age child. D. Adult woman. Answer. B. Newborn. The nurse is caring for elderly patients in a long-term care facility. What age-related alteration should the nurse consider when planning care for these patients? A. Increase in nephrons in the kidneys. B. An increased sense of thirst. C. Increased renal blood flow. D. Cardiac volume intolerance. Answer. D. Cardiac volume intolerance rationale. The elderly patient is more likely to experience cardiac volume intolerance related to the heart having less efficient pumping ability. The elderly typically experience a decreased sense of thirst, loss of nephrons, and decreased renal blood flow. When providing chemotherapeutic agents, which catheter is accessed with a non-coring needle? A. Peripheral central catheter. B. Hickman catheter. C. Groshing catheter. D. Implanted venous access. Answer. D. Implanted venous access. The oncoming nurse is assigned to the following clients. Which client should the nurse assess first? A 47-year-old who had a colon resection yesterday and is reporting pain. B. A 20-year-old. 2 days post-operative open appendectomy who refuses to ambulate today. C. A 60-year-old who is 3 days post-myocardial infarction and has been stable. D. A newly admitted 88-year-old with a 2-day history of vomiting and loose stools. Answer. D. A newly admitted 88-year-old with a 2-day history of vomiting and loose stools rationale. Young children, older adults, and people who are ill are especially at risk for hypovolemia. Fluid volume deficit can rapidly result in a weight loss of 5% in adults and 10% in infants. A 5% weight loss is considered a pronounced fluid deficit. An 8% loss or more is considered severe. A 15% weight loss caused by fluid deficiency usually is life-threatening. It is important to ambulate after surgery, but this can be addressed after assessment of the 88-year-old. The stable MI client presents no emergent needs at the present. The pain is important to address and should be addressed next or simultaneously, asking a colleague to give pain med. Which nursing diagnosis would the nurse make based on the effects of fluid and electrolyte imbalance on human functioning? A. Risk for infection related to inadequate personal hygiene. B. Acute confusion related to cerebral edema. C. Pain related to surgical incision. D. Constipation related to immobility. Answer. B. Acute confusion related to cerebral edema rationale. Edema in and around the brain increases intracranial pressure, leading to the likelihood of confusion. Constipation related to immobility, pain related to surgical incision. Risk for infection related to inadequate personal hygiene are nursing diagnoses that have no connection to fluid and electrolyte imbalance. A home care nurse is teaching a client and family about the importance of a balanced diet. The nurse determines that the education was successful when the client identifies which of the following as a rich source of potassium. A. Bread products. B. Processed meat. C. Apricots. D. Dairy products. Answer. C. Apricots. Rationale. Apricots are a rich source of potassium. Dairy products are rich sources of calcium. Processed meat and bread products provide sodium. Upon assessment of a client's peripheral intravenous site, the nurse notices the area as red and warm. The client complains of pain when the nurse gently palpates the area. These signs and symptoms indicative of what? A. A systemic blood infection. B. Rapid fluid administration. C. Phlebitis. D. An infiltration. Answer. C. Phlebitis. Rationale. Phlebitis is a local infection at the site of an intravenous catheter. Signs and symptoms include redness, pus, warmth, induration, and pain. A systemic infection includes manifestations such as chills, fever, tachycardia, and hypotension. An infiltration involves manifestations such as swelling, coolness, and pallor at the catheter insertion site. Rapid fluid administration can result in fluid overload, and manifestations may include an elevated blood pressure, edema in the tissues, and crackles in the lungs. A client aged 80 years, who takes diuretics for management of hypertension, informs the nurse that she takes laxatives daily to promote bowel movements. The nurse assesses the client for possible symptoms of a. Hypokalemia. B. Hypocalcemia. C. Hypothyroidism. D. Hypoglycemia. Answer. A. Hypokalemia. Rationale. The frequent use of laxatives and diuretics promotes the excretion of potassium and magnesium from the body, increasing the risk for fluid and electrolyte deficits. A nurse is initiating a peripheral venous access IV infusion for a patient. Following the procedure, the nurse observes that the fluid does not flow easily into the vein and the skin around the insertion site is edematous and cool to the touch. What would be the nurse's next action related to these findings? A. Reposition the extremity and raise the height of the IV pole. B. Apply pressure to the dressing on the IV. C. Pull the catheter out slightly and reinsert it. D. Put on gloves. Remove the catheter. Apply pressure with a sterile pad. Answer. D. Put on gloves. Remove the catheter. Apply pressure with a sterile pad. Rationale. This IV has been infiltrated. The nurse should put on gloves and remove the catheter. The nurse should also apply pressure with a sterile gauze pad, secure the gauze with tape over the insertion site, and restart the IV in a new location. A nurse is flushing a patient's implanted port after administering medications. The nurse observes that the port flushes, but does not have a blood return. What would be the nurse's next action based on these findings? A. Gently push down on the needle and flush it a second time. B. Stop flushing and remove the needle. Notify the primary care provider. C. Ask the patient to perform a Valsalva maneuver. Change the patient position. D. Close the clamp. Wait 3 minutes. Try flushing the port again. Answer. C. Ask the patient to perform a Valsalva maneuver. Change the patient position. Rationale. If a port flushes but does not have a blood return, the nurse should ask the patient to perform a Valsalva maneuver. Have the patient change position or place the affected arm over the head, or ride or lower the head of the bed. If these measures do not work, the nurse should remove the needle and reaches the device with a new needle. A nurse is administering a blood transfusion for a patient following surgery. During the transfusion, the patient displays signs of dyspnea, dry cough, and pulmonary edema. What would be the nurse's priority actions related to these symptoms? A. Slow or stop the infusion. Monitor vital signs, notify the physician. Place the patient in upright position with feet dependent. B. Stop the transfusion immediately and keep the vein open with normal saline, notify the physician stat. Admits antihistamine parenterally as needed. C. Stop the transfusion immediately and keep the vein open with normal saline, notify the physician, and treat symptoms. D. Stop the infusion immediately. Obtain a culture of the patient's blood, monitor vital signs, notify the physician, administer antibiotics stat. Answer. A. Slow or stop the infusion. Monitor vital signs, notify the physician, place the patient in upright position with feet dependent. Rationale. The client is displaying signs and symptoms of circulatory overload, too much blood administered. In answer, B. The nurse is providing interventions for an allergic reaction. In answer, C. The nurse is responding to a febrile reaction, and in answer, D. The nurse is providing interventions for a bacterial reaction. When monitoring an IV site and infusion, a nurse notes pain at the access site with erythema and edema. What grade of phlebitis would the nurse document? A. 1B, 2 circa 3D, 4. Answer. B. 2 Rationale. Grade 2 phlebitis presents with pain at access site with erythema, reddening, and/or edema. Grade 1 presents as erythema at access site with or without pain. Grade 3 presents as Grade 2 with a streak formation and palpable venous cord. Grade 4 presents as Grade 3 with a palpable venous cord greater than 1 inch and with purulent drainage.